Hi, I'm Dr. David Hill, and today we're going to talk about home remedies for chest congestion in children. Now, a cough, a cold is something that kids are going to get really frequently. The average preschooler or toddler gets up to 8 to 10 colds a year. So if you've got a child, you're going to be dealing with some chest congestion. First, a couple of warnings. If your child is wheezing, that is, he or she is making a high-pitched sound when they're breathing in or out, or if your child is showing some signs of respiratory distress, maybe he or she is breathing too fast, or you can see the skin pulling between the ribs or underneath the rib cage or at the bottom of the throat, or your child has a tough time getting out a long sentence, maybe he or she can only say a few words at a time or can't really run around, that's scary. Those are not things you need to be treating at home. That child needs care immediately at a doctor's office, urgent care center, or emergency room, depending on what's available to you and what time it is. So we're not going to treat any of those things at home. If your child has known asthma and has albuterol or Xopenex that he or she can use, then you might follow your doctor's orders on how to use that medication to relieve the discomfort, but you're still probably going to want to seek care relatively quickly. What can you treat at home? Well, cough, sort of a gurgly sound in the chest without those signs of respiratory distress, you probably are going to want to treat in the home. Here's one place where home remedies actually work better than medications. With children, except for that category of kids who have asthma, the medicines that we have to offer for cough really don't do very much and may be potentially harmful. Most of the over-the-counter cough medicines are based on a medicine called dextromethorphan that's never been proven to relieve children's coughs. So what are you going to do instead? Well, you're going to use honey if your child is greater than 1 year old. Why can't you use honey for a toddler or for an infant? Infants are susceptible to botulism. That is caused by an organism, Clostridium botulinum, that grows in honey. And in children under age 1 year, that organism can make them very sick and even be deadly. However, children over a year of age are able to tolerate the botulinum toxin well enough to take honey safely. You can put honey on a spoon. Do it the way your great-grandmother did it. If you want to add a little bit of lemon to it, that's fine. That's not what we've studied. We've just studied plain honey, but it might make it taste a little better. Do not add alcohol to it, no matter what the old-timers tell you to do. I know great-grandma used to do that, but we now know that alcohol is really very toxic to children's growing brains, and as tempting as it may be to put a little shot of whiskey in there, it's a really horrible idea. How often can you give the honey? I don't think there's an upper limit for how often you can give honey unless your child has diabetes, and that's a whole different topic right there. So, every hour or two should be fine. A humidifier may help as well. We usually recommend a cool mist humidifier. The steam humidifiers or warm mist humidifiers can easily cause steam burns if children get around them or too close to them, and often the steam is invisible so they don't even know to stay away. So a cool mist humidifier may help. Gently patting the child's chest may help mobilize a little bit of mucus, and those are the things you can do. Now, a cough with a cold is normal for as long as 3 weeks. It's the cold symptom that lasts the longest. The runny nose should only last a maximum of 10 days to 2 weeks without some significant improvement, but the cough can go on for 3 weeks. However, if there's shortness of breath, chest pain, or a cough that's going on longer than 3 weeks, certainly if your child is coughing up blood, you're going to want to be having that child seen relatively urgently. So, talking about how to relieve chest congestion in children, I'm Dr. David Hill.